We're back. We're here with Leah and Anna, and they're here to talk about the Missoula Forum for Children and Youth, and they're celebrating 20 years of existence.
So tell us what you guys are all about.
We're all about substance abuse prevention work. And also about coalition building and community. So that's pretty much what we're about.
Cool. And so what you guys primarily work with, what age group?
Well, we work with a variety of people, and so we work with community leaders, we work with law enforcement, and then we also work with organizations that work directly with youth. But primarily what we do is coalition building.
Okay, great.
Yeah. And we're really trying to do prevention work from ages 0 to 18. Really looking at how we can take care of our kids at a young age and give them what they need, and support them through decision making when they turn into teenagers, and help parents build that relationship. So that kind of happens in a few ways. We do outreach to families, we do presentations in schools, and we kind of do professional development to the people who work with kids so that they are can build their skills up.
Cool.
Yeah, one of my questions I had earlier was what is the difference between now compared to when you guys first started?
Right, so obviously we started back in 1996, and what we were primarily looking at was substance abuse and also violence prevention. And we've had several different work groups through the past. We've talked about teenage pregnancy, we've talked about volunteerism among youth, but now primarily our focus is pretty much just substance abuse, and looking at also why does that happen. So Anna's work is primarily looking at how can we prevent trauma from happening to kids early on. So if you want to talk about it.
Yeah, just understanding that one of the factors, there are a lot of factors in whether children and youth use substances when they get to an age where they're thinking about that, but one of them is whether they experience trauma as children. And so how can we prevent that? And in preventing that, we're actually helping them have a healthier life in a lot of different ways. And then also helping them get ready for kindergarten, because if you are, developing it in a way where you're able to jump into kindergarten and learn what you need to learn and feel connected to your teacher, then you're going to have a lot easier time engaging in school, feeling like you're a part of something, not struggling the entire time. So really starting young is such a great way. And then helping families have that positive interaction with kids so they have a good relationship and they can talk about things as kids grow up.
And so you guys, do you go into homes as well as schools?
We don't generally go into homes. I mean, Anna does work with a nurse-family partnership.
A variety of home visiting programs, yeah. We work with the programs that do the work with the families. Yeah, we kind of help coordinate because there's so many services in Missoula. And so how do you get everyone on the same page, not duplicating services, referring to each other like they should be referring to each other. We have a great group of collaborative people in Missoula, but there's a lot of them.
And then our colleague Brandy, she runs the Missoula Underage Substance Abuse Prevention Coalition. She also does some presentations within schools, and so she talks with kids directly about just decision making, not necessarily like don't do drugs, but more like really helping them kind of think about that, and then bringing and then giving them materials to give to their parents so the parents can have that conversation as well.
Yeah, I do the flagship program, so I work with a lot of kids after school, and a lot of times, sometimes they come up with random questions, and I ask them, what do you think you should do? It's the only advice was I try not to give them too much advice, because a lot of times, if you're telling kids too much what to do, because there's always a huge trend of kids saying you can't do this, you can't do this, you can't do that, you can't do that. So I think one of the things that I should tell the kids is if you feel like something is wrong, then you should just let me know.
Yeah, exactly. Yeah. And I feel like that's the best way to start, is just younger and helping them with decision making rather than being this is wrong, this is right. Talk to them why is that wrong? Why is that right? And how will that affect your life if you do that? So I think that's just great. It's a good way to approach children, I think.
Because there's a lot of decision making that the kids really have, especially when they're young. He's should I go on the teeter-totter, the swing, or the slide?
God, wouldn't that be awesome if that was the biggest decision we had to make in a day?
Yeah.
Not anymore.
I think a little bit of that too with young kids is, somebody hurt my feelings, how do I handle that? And how do I lash out, or do I talk to them in a nice voice and say that didn't feel good? So I think some of that decision making comes into recognizing what doesn't feel good and how do you handle that. And really the younger kids try alcohol or other substances, the more likely they are to have a lifelong addiction problem. So really just thinking about the lifelong impacts that things could have is really what we're trying to have them understand. Like, these are the stats, these are the facts, you get to make your decisions. And you know how to think about your body and what makes it feel good and what doesn't.
And I think that one of the bigger issues that are happening now is prescription drug abuse, because you understand, like, a lot of times when if a kid's in an accident and they have to take oxycodone or whatever like that, there's a chance of getting addicted. But also it's like encouraged that they actually take it from trained professionals.
Right.
Exactly.
And then it really confuses them a lot. It can be really confusing. So what is your guys' approach on that?
So we actually have a prescription drug task force that works primarily on talking with the community about proper use and proper disposal. So making sure that once you're done with the prescription that you throw it away properly, which is actually, you're not supposed to throw it in the toilet because it actually gets in the rivers.
Oh yeah.
Yeah.
I've heard
so
of that.
there's actually some drop boxes. There's one at the police station, one at Curry Health Center, and then there's another one somewhere else in town. But just making sure you drop those off. And then knowing that also, just having parents talking with kids about what's the appropriate dosage and not using drugs from their friends as well. So
Yeah, exactly. That's awesome, you guys. So how can people get in contact with you if they want to get your advice or your services?
So you can go to our website, so it's MissoulaForum.org, or you can call us at our office. I don't know if you want me to get that number or not. 258-3020.
And then do you guys do community lectures and?
Yes.
Okay.
So Anna does a couple of different trainings.
Yeah, I do a training on the Adverse Childhood Experience Study, so how childhood adverse experiences can affect brain development and what that means. So when you're working with kids or adults who have maybe been through that, how do you change your approach in working with them so it meets their needs, really? And then also a child sexual abuse prevention training as well, what can you do to shore up your organization or your child's schedule so that you're not leaving room for something to happen that could be really detrimental, because child sexual abuse is a big indicator of a lot of other issues later on. It just makes a lot of things harder for kids later.
And then Brandy does a couple different presentations as well. She talks about prescription drug use. She also talks specifically, like I said, about decision making. And so talking with kids about that as well.
For kids, we have a media literacy presentation that kind of talks about, hey, who's making your decisions? Are you, or this company spending billions to get you to do what they want?
Right. I just love that. I feel like that's so great, that approach, because I feel like, is this approach new? I don't know. I feel like it is kind of new. Because I don't know. I feel like, when I was younger, it was never no one asked me about my decisions or my choices. They just told me.
Yeah, I was dare.
Yeah. So
dare.
how was I supposed to know without actually doing it?
Exactly.
No one gave me the choice.
Yeah.
So
and they show actually that the DARE program in the 80s actually helped some kids, but the people that were actually more likely to use drugs anyway, it actually made them more likely to use.
Yeah.
So yeah,
it's a joke.
Exactly. Yeah.
Either it worked,
it
worked too well or not well enough.
Right.
Schools where they had a good relationship with, because it was presented by police officers, I think it showed some increase of a positive relationship with the police, but not substance abuse prevention.
No.
So it had some positive effects in some places that was absolutely not what it was intended to do.
Yeah, I always had great positive experience. When the police ever came down to the, visit the kids and all that stuff, they had their gun in the side. It was whoa. Especially if you're in Montana. It's everyone respects people with guns. That's just the way that people in Montana are. It's just Yeah,
So,
again.
what are you guys doing to celebrate your 20 years?
Oh, well, we're having a celebration today over at the Garlington Loan and Robinson building. We're going to have an open house. We're going to have displays of, all that kind of history of what we've done in the past and all of what we're doing now. We're going to celebrate all of our partners that we have now and from way back. And so we're really hoping that we're going to have a big group of people that have been through with the forum for years and years. We have hundreds of people in Missoula that have been a part of the Missoula Forum in the past. And so we're really celebrating all of them.
Yeah.
And we have cake.
And we have cake.
Importantly.
And since you guys have been around so long, do you guys have any kids that you've had since they were 0 or 1?
Gosh.
Well, I feel like because we're mainly working with organizations, they have kids that they've seen grow up. We work more with the people in the organization, so it's really fun to see in that sense, like people who started out. Everyone has worked at Early Head Start and my Early Head Childhood Coalition, and then they moved to the YMCA or they moved. So people moving throughout their careers, but we're mainly working with the adults in this case, and then going and doing presentations with high schoolers in a smaller amount of time. So
Cool.
Yeah.
That's awesome, you guys. You're doing such great work for our community, our youth. Yeah. Well, is there anything else you'd like to touch on before we let you go?
I think so, yeah.
How about you plug your number and where people can find more information?
Yeah, so our number is 258-3020, and also you can go on our website, MissoulaForum.org.
Yep.
and if you have a kid in your life age 0 to 8 and you're interested in what services are out there, because Missoula has a ton of them, go ahead and check out healthystartmissoula.org. It's one of our other websites.
Yes.
Great. Thanks, ladies.
Thanks so much. Yeah.
We'll be right back after this, everyone.